Services Committee to order. Senator Hatch, can I put you on the spot and open us up with prayer?
Let us pray. Joe and Father, thank you for waking us up this morning. We just pray that you put a hedge of protection around the members of our districts and our families. And please continue to guide us and lead us and let us do your will. In Jesus' name we pray, amen.
Thank you, Senator Hatchett. So we have a Senate Bill 256, a department bill by that Senator Burke is carrying, and this is going to be a hearing only today. And let's have Senator Burke is at his will if he wants to present it, or see we got help in the back of the room, and let's sort of go through this.
And members of the committee, first of all, I want to start off by just thanking the Department of Public Health for the work that they've done during this pandemic, and with some would say their hands tied behind their back, they've done yeoman's work. Also like to thank our Legislative Council and Senate Budget and Senate Research for helping me pull this together in a very short period of time. Betsy, as always, has done magic with just an idea and a prayer, and we give it to her and something comes out of the box over there. So I want to thank her publicly for her work on this. And she was the first one to say that we needed to work on it, because it is a first pass at a very, very complex subject. I've been involved with the Department of Public Health budget, I guess, for 7 years now on that subcommittee, Mr. Chairman, that you recently inherited as chairman. And I would venture to say, even though the Medicaid budget is complicated, the public health budget rivals it because of the inflows of money from the federal government, a lot of grant money that has to be managed in a particular way, and then the complexity of the public health organization in Georgia, which has been established many years ago and hadn't really been updated in any length of time. And I think the work we did in the amended budget to provide them with resources, both for their technology needs and personnel needs at the department on the leadership level, just points to the fact to the challenges that they're working under. But again, want to make sure that everyone knows that this bill is no reflection on the people that work in the department. It's actually an attempt to give them more tools and resources and a better structure so they can be more effective. I think all of us want our public health system to be the best in the country, if not the world, if that's possible. That's certainly my goal. So just an overview. The bill is long, but it's mainly because some of the language is just throughout the code that we're trying to improve. And I want to just mention what I would call the overarching goals. We've got 18 public health districts in the state, and by code, those 18 districts are led by a physician. And as Chairman Watson and Chairman Kirkpatrick know, physicians are great at science, at clinical management, but finding physicians with the skill set to manage a large department such as these regional health departments that have the desire to want to do personnel management and budgeting and so forth is a big challenge for the department. And this bill allows professionals in public health, MPHs, master's level minimum, and doctorate level to have those posts, but it's very important to realize the bill contemplates that each district will have a medical director. Again, not necessarily every district will have one. That would be a decision based on the department's needs and the county's needs. Some districts may need more than one, and some districts may share a medical director. But that would allow the physician leader to focus on what they know and what they do best, and I think it would allow the department to find people that are passionate about public health, but maybe not so passionate about managing people. The other thing to realize is this is permissive. It allows public health to do this, so all those folks that are in those roles right now, it's not like they're about to lose their jobs, because you know, this will be dealt with over time and attrition. And again, that was one of the things that I thought Betsy did a good job of defining, that this allowed the commissioner to make those appointments with those qualifications, but it doesn't require that to happen at a time certain. The other thing that it does, and I've talked to a lot of local public health folks. My wife actually worked as a public health nurse for many years in her career, if you talk to county leaders and ask them, you know, who runs their health department, they say, well, the state does. You ask the folks at the department in Atlanta who runs the county health departments, they'll say the counties do. And so there's this misidentification because of the structure of who's in charge. And when it's like this, both are pointing to the other, then obviously you have challenges. And again, I want to emphasize, we have some county health departments that are world-class already, and some of those are going to look at us in consternation and say, why are y'all messing with something that's working? But then we have other counties that are struggling, and some of those counties may only have 2 personnel working in a county health department. One of the things that I'm trying to accomplish, of course, is have a good public health structure, because our access in rural Georgia for health care is very, very limited in a lot of regions. And we all point to the fact that we've got a health department in each county, and we also brag about the fact that each county, I think except for maybe one, has access to telehealth capability in that public health department. But one of the, I guess, dirty secrets is frequently in those counties that equipment is sitting in a closet and hadn't been used in 5 or 10 years because they don't have the resources or the processes to actually have it be an effective healthcare delivery system. So again, I want to stay at a high level because this bill is green, and we just got it in our hands this week, and I'm working with obviously Megan and the folks in the public health department. We actually have plans to meet over the weekend to work on this, but I'll be glad to allow her to summarize the department's thoughts at this time, and then be glad to answer questions. Mr. Chairman, thanks for your willingness to talk about an important subject today.
That'd be great. Thank you. Ms. Andrews, would you mind coming to the podium and maybe get down to a little bit more of the details? That was an excellent overview. We appreciate that. I must say this is actually the first time I've seen the bill this morning. So probably everybody on the committee still struggling wrapping my arms around the structure. So I really want to hear some of the details on it.
Sure, happy to help. Hi, everyone. My name's Megan Andrews. I'm the Director of Government Relations for the Georgia Department of Public Health. Happy to join you all this morning to talk a little bit about the current structure of public health in Georgia. So right now, the state is divided into 18 health districts, and there is a district health director over each of those districts. They are a physician. As Dr. Burke mentioned, we have had some trouble filling those health director positions. There's a handful that have been vacant for a pretty long period of time, despite our best efforts at recruitment. I think part of the challenge is it's hard to get a physician to leave private practice to come work for the state. The pay just isn't something that is enticing to them. It's also very difficult to find someone that's both an amazing physician and also a really great organizational manager. That's a really unique person that's difficult to find. We have some great health directors around the state, no doubt about it, but there are health directors that are kind of carrying the load for several districts right now and have been for years. So that is one of the challenges I wanted to make sure you were aware of. One of the other challenges is with that structure is when Dr. Toomey does find a health director, she selects them, but she has to go shop them around to every county board of health in that area, in that region, and they have to vote and approve that person. So it does take some time for her to essentially lobby the county boards of health to accept this person as the district health director. So that's another piece of the puzzle that is a challenge. The other thing I think COVID has kind of brought to light a lot of challenges within the department. It's been a unique opportunity to be able to reflect on how we're working in Georgia, how we can improve. And I think Dr. Toomey we're so blessed that she's in this role because she came from a district. She was the district health director in Fulton, like 3 months before she came to be commissioner of public health. So she has that very unique perspective of what it feels like and looks like as a health director, and also like what the needs are from the state to the health directors. So she has done an amazing job at building relationships with all of the health directors around the state, more than I've seen historically. I mean, I was only here for about 6 months before Dr. Toomey started, but I will tell you it was night and day from before she started and after, where she's really worked cohesively with them. That being said, I don't think it is difficult because Dr. Toomey's not going to be in this role forever, right? There's going to be a new commissioner at some point, hopefully in like 50 years. But you can't guarantee, right, that a new commissioner is going to be able to build those relationships in order to have a cohesive COVID response. And hopefully COVID never comes back and we never have another pandemic. But if anything we've learned, we need to prepare for that scenario to happen again. And I think, as I said, Dr. Toomey was great about being able to work cohesively and get all the health directors on board to have a united strategy, but that's not something that's guaranteed. That's not something that every commissioner will be able to do. It's an important part of the role, I think, but that is another piece of the challenge of the public health system in Georgia. And I'll be happy to take any questions if anyone has any.
Why don't you take us through some of the sections of the bill?
Can I have a copy of the bill?
Some of the major sections. I mean, I think we're talking about section 21, you or Dr. Burke, and section 22, section 23 seem to be the heart of the bill. Just with me looking at this, you're sure you looked at it a lot more than I have. So if you could sort of take us maybe through 21, 22, and 23.
Sure.
And I think we have Ms. Scherer wants to just comment on it too. So.
Okay.
Am I wrong? Section 21, 22, 23 are sort of the part of the bill?
Yeah,
then?
so that, that's really the substantive changes here. So right now, when they're talking about, in section 21, the chief executive officer and director, that is the health director. So health directors in the state of Georgia have two people they report to. They report to their county boards of health, and they also report to the commissioner. So there is kind of that unique structure there where they have two separate but equal bosses. So this is allowing the county board of health to still appoint a CEO, a physician to be CEO of their board. The language that is stricken is related to environmental health, and explaining the relationship between the county and the state, and having like the environmental health staff that work at the county report to the director of environmental health and make sure that information comes up to the state. Section 22 is about the district health director that I mentioned earlier. This allows DPH to select a district health director to oversee the operations of the local health departments around the state, and takes out that piece where Dr. Toomey has to go to every county board of health and have them vote on it. This adds clarification that the local health departments in every county in Georgia report to that district health director and are subject to the oversight of the commissioner. And the county board of health serves in an advisory capacity to the district health director on the public health needs of the local community. And then, do you want to ask a question? Okay, I'm just going to finish this last section and then I'll come to you. So the other piece of this puzzle is the health districts. So right now, Dr. Toomey recommends district structure, like District 1 should be these 10 counties. If she ever wants to change it or tweak it, she does have to do that same lobbying effort with all of those county boards of health, and they do have to approve it. One of the actions that were taken during the budget cuts last year, it feels like 10 years ago, but we did initiate a merger of Clayton County into the Lagrange district. Right now, Clayton County is a standalone district. That is a vacancy, a district health director vacancy that we've had for over 3 years. We just haven't been able to recruit anyone, so part of the Dr. Toomey identified eliminating that position during budget cuts as a way to reduce costs and kind of bring them into the Lagrange district, which really does have an amazing district operations. But we have had difficulty in completing that project, one, because of COVID, two, because Dr. Toomey, it takes time for her to go talk to all of these Board of Health chairmen and get their buy-in. So that's addressing this district issue, Section 23. So it also talks about the district health director's qualifications. So Dr. Burke mentioned the difficulty with finding the right type of physician to oversee health departments. So this talks about allowing someone who's really an expert in the public health system in Georgia and has appropriate education levels to really manage the day-to-day operations, so the budgeting and the HR issues and the finding a building location or all of the logistics things, and then having a chief medical officer that oversees the clinical programs at local health departments like our Ryan White clinics, our family planning services, our immunization programs, because we don't just do the COVID vaccine, right? We do back to school vaccines too. So all of those clinical operations and the nurses would operate under that chief medical officer. And I think that's
Okay.
a broad summary.
I have a question, Senator Kirkpatrick.
Thank you, Mr. Chair. You started addressing one of my questions, which was the district map.
Yeah.
And I'd like for you to steer us to where that is in the bill that gives the commissioner the ability to change that without.
Yeah, so Section 23, current law says the department's authorized with the consent of the boards of health and the county authorities to establish health districts. This is allowing Dr. Toomey or the Commissioner of Public Health, whoever that may be,
Okay.
to.
And then, if you don't mind, Mr. Chairman, I have one other question. I represent a couple counties that actually function very well. Cobb County in particular functions extremely well. And our local school district looks to them for direction on answering their questions and so on. I'm just trying to understand the impact on the counties that have a functional system that are not the same as some of the other counties that are struggling. How would that affect their operations?
Yeah, I don't see that impacting the relationships that they have with their community. I mean, that's public health, right? Everyone brags, there's a county health department in every county in the state of Georgia, which is a lot. And they really do serve their community, the schools needs. They do work great together, and I don't see this as changing any of that. This is just kind of doing a little restructuring to make a little restructuring, but they are still expected and will be working with their communities. And the County Board of Health, right, they have the superintendent of schools sits on the County Board of Health. I think it says the superintendent of schools for the largest school district in the county. And the County Board of Health in this bill still exists. They are to advise public health on what the needs are of their community, the public health needs. So there is a voice, right, of the school system in that board who is still in existence and still recommends to public health what needs to happen.
Sure. Senator Hostetler.
Yeah, thank you for being here, and I really appreciate all the hours that you've had to put in. I know you've worked long and hard over the last year, and for those members of the committee that are new, she used to be part of this group here providing us science and legal research, and kind of grew up in this committee is the way I think it is, but she's done a tremendous job. I emailed her one Friday night about 9 o'clock just so she could get it, maybe over the weekend or something. She emailed me back within 5 minutes, which told me she had no life other than working all the time, just like me. What am I doing at 9 o'clock at night? Dr. Vocio is our health director. He is a pulmonologist who was just retiring, who I'd worked with a lot, and the timing to me was perfect having him in there in that role with COVID, having a pulmonologist over it. And I think he's done a good job. And when I look at this, I think this is a better management structure to get consistency across the state the way we're doing it. I mean, the county boards are out of the business of promulgating on page 6, and I know everybody likes to promulgate, but maybe they shouldn't be promulgating quite so much. They're getting out of the role of micromanaging septic tanks, it looks like, and things that maybe others can do. And I know you've had to make changes because it's sort of the same thing in different sections. But overall, I think this is a much better structure to have consistency across the state and clear guidelines for everybody. And I think, from what I'm seeing here, I really appreciate this bill and like it.
Thank you, Senator Hofstetter. And I will say we are so lucky Dr. Vocio came on. He's one of the recent hires. I think he's our newest health director, and he came on right before COVID, and we were lucky.
Yeah.
We were lucky we could steal him from the hospital.
I hated to see him go. I'd worked with him a lot, but they replaced him with 2 people, which he doesn't mind telling you. It took 2 people to take my job over.
Yeah, I must say that I'm one of those too, is almost exactly like that. Dr. Lawton Davis came on. Of course, he had been with the health department up in Lawrence County and Dublin area, and he came on and is the coastal health director that's all of the coast from Savannah down to Camden County, St. Mary's area. So, and goes up into the southern portion of Georgia also. So, a huge benefit. He's been a great leader in our community and has done a fabulous job.
And Dr. Toomey will tell you she hired him when she was health commissioner 15
And
years ago.
we've had some folks in Savannah that we've loaned the state, and I know y'all are appreciative. As a matter of fact,
Yes,
you
we
may have
do
helped a little bit with this
appreciate
bill, I understand, and it's much appreciated. Just for clarification, so if they're not doing the several issues there, who is doing them? The food and sewage and animal cruelty and so forth?
So I'll tell you a little bit about how it's structured right now, because I think that'll give you kind of a historical reference for what we're looking at. So right now the state sets sets rules, and the county boards of health agree to them. So in Georgia, we have the same food service rules across all of our counties. So every county in Georgia is under the same restaurant inspection rules. There are employees that work at the county level. They're county board of health employees. They're not state employees. They're the ones that go out and do the food inspections. So the way this would kind of change the structure is those inspectors that are going out, they would become state employees, and they would report to the district health director, and the reporting structure would come up through the state, as opposed to right now they report to the county board of health.
So it's a county employee who switch over to a state employee.
Mm-hmm.
How many of those do we have?
There's a lot. I can get you an exact number. And Melody brought this up when we were talking to a couple points about that. They are in ERS already, the employee retirement system for the state, and they are in the state health benefit plan. So they're really county employees. Really, it's just how they code the budget that they're paid out of.
So their salary comes out of the county budget or the state budget?
The county board of health budget, which is different than the county.
So it's the county budget.
So the county
So,
board
but-
of health they get grant and aid from the state, and Melody's much better at explaining this. They get state aid
Okay.
to the county board of health from you all.
Gotcha.
When you sign your big budget,
So we
they also
supplement,
get
it's sort of
count-
like the teachers, we supplement their salary.
Yeah. And then the
Senator
county
Burke
pitches
may-
in money, and it
why don't
sits
you,
with the board of
help us
health.
out with that?
Yeah.
Yes, and that was the part I was talking about in my opening comments about the complexity of the funding system, because the money, there certainly are county funds involved in managing the health department of varying amounts. For some counties, it's we would call it minuscule when we're talking about state budgets, and then other counties, it's obviously a very significant amount. These larger metro counties are certainly providing a lot of funds to supplement. But I've had Melody and Caitlin, even though they haven't had much time and certainly are not finished reviewing this bill, but again, this was just a comment from Melody yesterday that so far with their evaluation of it, that they feel like this wouldn't really change the financial structure, that because of the way we've done this and the fact that these county employees are kind of a hybrid already. They're in the state system from retirement, they're in the state system from health insurance, that it probably would not make a significant change in their day-to-day lives, and certainly wouldn't change their benefits. So, but that, again, we need to dig into that a little bit more and have a lot more conversation about that.
Yeah, I mean, probably the easiest thing to do is just get a fiscal note, and that would be to get some official version there. That'd be the easy thing. Easy is put that in quotation marks.
Yes, exactly.
Right. Easy to request, let me put it that way. So I appreciate that. Does the committee have any further questions? And we don't have a full committee here. I know that Senator Dolezal is working on another bill in prep. Senator Halpern is left. Senator Jackson's not here. Senator Orrick's not here. Senator Kennedy, Walker. So we don't have a full committee. Cowser, we only have one lawyer here, but and no questions. Senator Al, I think you may have an MD. Do you have a MPH? Yeah. Okay. All right. So probably first time you've seen this bill too. Okay, great. All right, so, and I think that I know that we've gone over, but I apologize for starting late, but we've run over later. So, Ms. Sheriff, if she's here, I know that she not opposed. She just had a couple of concerns. So if we could
Want me
have
to get
her
her?
come in and
Yeah.
speak, that would be great. Good morning. She's coming around behind you.
As all of you know, I'm Bethany Scher with the Medical Association of Georgia. We want to thank Dr. Burke, Dr. Watson, the Department of Public Health for all of their work on this. I do want to say that this is obviously a big change from our current structure, and the bill is long, it's, 30 pages. We have not had a chance yet, with just having seen this within the last about 24 hours, to fully vet this with our physicians. We are particularly concerned with Section 23, which is the portion of this bill that talks about who would be the public health director in these districts. And our main concern is when we take physicians out of these local areas, obviously some may still be physicians, that we don't then have sort of boots on the ground of physicians to oversee these day-to-day operations that may affect the health of many Georgians. And obviously we understand that the CMOs, there could be a number of these chief medical officers at the state level, but we're not exactly sure how those would interact on a day-to-day basis within those district health those public health districts. So, we continue to vet this with our physicians, and we're looking forward to working with Dr. Burke, public health, and everyone involved in this to hopefully come up with something that helps public health better, use our resources across the state to improve the public health in Georgia, but also provides that, sort of the utmost quality that we can. I'm happy to take any
Thank you.
questions.
Thanks so much. Any questions at all? Senator Al, there you go.
So I just have a question, just because I'm seeing this bill for the first time. So basically what this Section 23 says is that the district health director does not have to have an MD, but they will oversee or work with a CMO that would be a physician.
So that's my understanding, but my understanding is that the CMOs, we don't know how many CMOs there would be or where those would be located. I'm just not totally clear on how that would work. The structure within the bill doesn't clarify whether there would be one CMO for the whole state of Georgia, whether there would be 5 CMOs for the whole state of Georgia. And so we just worry that, let's take a pandemic, for instance, that is, all across our state. If we started the pandemic and we only had, let's say, 2 physicians working in these CMO roles, that would have been a lot for them to deal with across the state, especially as we're dealing with like this vaccination rollout and how we approach vaccine hesitancy. Just being able to be responsive to local communities, if those physicians are more, let's say they're up here in Atlanta, are they able to then react to sort of nuances within local districts?
Got it. So the concern is the ratio of the district health director to the number of CMOs, that it wouldn't be 1-to-1 or even 1-to-3, that's not spelled out.
And then the location of them. So are they physicians who are sort of knowledgeable about the differences between the needs of South Georgia versus the needs of Atlanta?
Got it. Okay.
Senator Burke.
Yeah, thank you, Bethany. This is just a comment, and Bethany knows this. I'm a physician from South Georgia. Dr. Toomey is a physician from largest county in the state, and we're working together to make sure that both needs are met. And so I don't know what else to say other than been here a long time, and I hopefully you understand that I'm not going to do anything to degrade the quality of the program. So. Can't say any better than that. I probably could have done it better, but just want to reassure you.
Absolutely, and we appreciate
what you're
it.
saying would be the farthest thing from my mind.
Absolutely.
Dr. Watson, just one more thing.
Sure, follow up, sure.
I will, just to follow up, just to point out that even with the ratio being a question mark, that obviously the training and the expertise of someone who does have a public health degree, even though there is some overlap, it does differ from what a medical degree provides.
Right.
And just as someone who has both degrees, that you're shocked at how little overlap there is. And even though obviously the MD does provide some experiential expertise that's important, especially when rolling out certain campaigns, that public health aspect, being the public health director, is, I think, maybe more important.
We appreciate that.
Yeah.
Thank you. Do we have any other questions, or comments? If not, well, I think that just the posture of the committee would probably be to get a fiscal note and let's review it, refine it. I think that if we can sort of collaborate, work together and get it just fine-tuned, I think we're all not against reorganization by any means. But like you said, we want to, if we're going to change, let's change for the better. Let's make it a really good product and sort of go from there. Unless there's further comment or questions, meeting is adjourned.